asshole for not telling my husband that I'm dealing with depression. I, 30s male, and my husband, 30s male, have been married for over 10 years now and have been together for 15. I started getting kidney stones right about the time we got together in my early 20s. Over the years, they have gotten more severe to the point where I'm now classified as having kidney disease. I've been to many doctors and tried all their suggestions, from diet changes to medicine, but mine are a very specific hereditary nature that are not easily treated. When it first started off, I would maybe have 1 or 2 a year. Now I'm at the point where they are constantly there. I've grown accustomed to knowing when they are coming on and how far they are in the progression by knowing where the pain is, but I still get surprised every once in a while. Some days are better than others. I might have a few moments of discomfort that pass rather quickly. Other days, it can be so severe to the point that I'm puking and getting migraines from the pain. It really varies a lot from one day to the next. I don't take painkillers daily. Ibuprofen is usually suggested by the doctors, but it causes me severe stomach pain that can sometimes feel just as horrible as the stones themselves. I'll generally self-manage the pain with some pot to sleep at night, and since the stones make me insanely nauseated, I'll smoke a little before I need to eat. Also helps to take the edge off and dose the sharp pain into something more manageable, even if it doesn't fully prevent it. With how frequently I have them now, I rarely go to the doctor unless I know something is really wrong. For instance, for 95% of my stones, they are small enough to pass on my own, but I will occasionally get one that causes a blockage, preventing me from urinating. With those, I go to the ER right away, and they will either give me fluids to try and force it through, or perform a lithotroscopy to break them down into smaller ones that I still have to pass. Over the years, I have slowly pulled away from discussing them with my husband, and I even started actively hiding them away when I'm hurting. I'll go into a different room, step outside into our backyard, and avoid him at all costs. I don't know exactly when I started doing this, but upon reflection, I do understand why I did for a multitude of reasons. Number one, after so many years, he will get verbally aggravated and frustrated about it if I mention that I had one. Like, Jesus Christ, again? Pete, that just pissed me off for Jesus Christ again. While I know he is voicing frustration for me and not at me, we've talked about it. It still feels like the same thing sometimes. Number two, I hate how it makes him feel utterly hopeless and can't do anything about it. Three, I feel like I'm placing some kind of undue burden on him. The looks of worry, pity, and concern make me feel extremely guilty. I used to have a pretty active social life that I also dwindled away to pretty much nothing. Gave up things that I used to enjoy because I completely lost interest and honestly just don't want to be around anymore. All that being said, between the pain, destruction of my sex drive, weight loss to the point of family and friends actively pointed it out, and so many other negative side effects that I haven't gotten into, my PCP diagnosed me with depression 3 years ago now. I started taking a prescription that is supposed to help, while also is supposed to have the added side effect of causing weight gain. It's non-narcotic. And I started seeing a telehealth therapist. I have not told my husband about any of this. OP, I can just imagine how lonely this shit must feel. Like, you feel like your health diagnosis is a burden on him, and I cannot imagine it. I'm fortunate to have switched to a work-from-home job that has great pay and benefits with a flexible schedule if I'm not feeling my best. So I always schedule my telehealth meetings when he is at work. My prescription is kept in my office. Mentally, I'm trying my hardest, but I feel worn down, beaten, and broken. And every time I feel this way, I want to talk to my husband, and at the same time, I don't. I feel like your husband loves you, and although you said that he can express frustration and that you can accept the fact that it's not to you, it's like for you, I think that you still should talk to him about it. The mix of emotions is insanely confusing, and I know I'm going to feel guilty whether I talk to him about everything or not. Even as I'm typing this, I'm getting waves of pain, and my emotions feel like they are all over the place. I feel like I'm being a horrible person. So, am I the asshole for not discussing my depression with my husband, or do I have the right to keep this to myself? OP, obviously, because this is your own diagnosis, of course you have the right to keep this to yourself. However, I feel like this is something that impacts you every day, and it's very painful. So, like, you intentionally keeping it from somebody, I feel like it mentally can make you feel like you don't have anybody. So, I feel like you should talk to him. I feel like he'll be okay. Like, it's okay for him to be frustrated, but I don't feel like you should handle it by yourself.